By 2020, we're looking at like a 75% increase in people over 65 in this area. That's huge. And so we're trying to figure out what do we need to accommodate the housing issues, the care issues, the health care issues, transportation, those kind of needs.
There have been a lot of discussions in the last couple of years to find out what it is that most concerns seniors in the community. The Office on Aging has done a major survey, and transportation almost always comes out on top of that.
I needed to go to my doctor's office one day when it had snowed, and I just don't drive in the snow. So I called the yellow cab. It was $18 from my house to the doctor's office.
And housing comes in almost a clear second.
With the low vacancy rates in Fort Collins and the cost of housing, it's difficult for some seniors to find affordable housing.
And it's not just about having housing, it's about having housing that provides access to services and to social support. I think those are critical aspects that sometimes are overlooked when we're planning housing developments.
Services have not kept up with the need, the growing need that seniors have.
It's going to be a marathon trying to make sure that we have a community that can accommodate that population of people, and we have to start today to make people aware of those issues and help find solutions to those issues.
The foundation was started by a small group who wanted to help elderly people who needed assistance.
A woman named Mildred Arnold, who's a retired professor of home economics from CSU. Before she died, actually, left about 80-some thousand maybe to be used in service of low-income seniors in Larimer County.
So that's how we started giving grants for people that needed just a little bit of help, and there are all kinds of needs. A new roof on the house or a mobile home.
I'd say probably utilities is the most common request. We help with prescription assistance, dental care.
Those kinds of things that really needed to be addressed simply, without a lot of paperwork, and for which no other agency really could support.
There were many, many things that we did early on that were kind of first-time things in the county. And one of the early things that we did was getting more physicians who would accept Medicare, also working on affordable housing.
And then it wasn't really until 5 or 6 years ago that the Office on Aging came to us and said, would you work with us to try and find additional support for services for seniors in the community.
Up until that time, the foundation had primarily been only providing small emergency grants to seniors in the community, which is still a very needed service, and we really want them to continue to do that. But we also realize there are services that are really struggling, and we really need to keep them in place.
There are just many, many people who need more money than they have to get by, but they also just need a boost sometimes and some human support so that they feel that they're not alone and their attitude can be better.
The biggest thing that we want to work on is not to isolate seniors. And whether that means that we move services to their areas and kind of in satellites, which is something that Elder House is considering, or if we improve the transportation so that they can get places.
So finding them, identifying who they are and how we can best get the services to them is probably our largest challenge. And in doing that, we need the help of everyone in the community.
I see the Foundation on Aging as sort of being the central hub of the conversations that we're having around aging that brings together nonprofit, for-profit, individual community members and governmental agencies and create a system that is supportive of seniors and their needs.
Having a community that offers choices, has choices from the standpoint of social needs, physical needs, economic needs, and that we can live here with all those things being accessible to us.
That's one thing I hope the foundation can continue to do, is to find needs by cooperating with all the community and working together to find where the needs are, and then working together to meet the needs.
So our goal is to have a community where you're comfortable if you're 5 and you're comfortable if you're 90. And I think the comfortable if you're 90 needs some work.